skip a bit.
Okay, we're calling the meeting to order. And we are recording. They'll just turn the recording on and welcome everybody on this kind of cloudy, but kind of cool and refreshing day. So we'll start off with the Rotary motto. Bill?
You see that?
Okay. Service above
Service
self.
above self.
All right, let's all stand for the Pledge of Allegiance. I pledge allegiance
To the flag
The flag
of the United
United
States
States of America.
to
and
the
to the
republic
republic
in
which
which
stands
nation
one
one
the nation
under
is
God,
under
God,
indivisible,
justice
for all.
justice for all.
Oh my gosh.
Okay,
All in unison.
and we will go ahead now and we'll observe 1 minute of silence. Okay, thank you, Bill. And we'll kind of zip through a few announcements here. And we do have a guest speaker today. It's Kara, and she's director of the Eastern Shore of Virginia Public Library, and she'll be speaking with us today. And Kara, welcome. And we're going to take care of a little business, so you can kind of kick back and relax for a few minutes. All right. Let's see here. Okay, first announcement is we're thinking about other projects, and you can email them to me if you think of anything we'd like to do in the community or the greater overall Eastern Shore, Virginia area. I want to turn it over to Paul to give us an update on the COVID situation.
I'll start with the bad news first then. Well, as probably most people know who've been watching the news, COVID continues to surge, driven by the Delta variant. Accomack County has now spiked up to, they had 45 new cases last week, which makes their rate, if anybody gets, those of you who get my little weekly report, I report the cases per week. I've been doing this, the cases in the week per 10,000 people. The CDC uses the rate per 100,000 people for their guidance. So you have to multiply my number there by 10. So Accomack County now has 139 cases per 100,000 population, which puts them into the high transmission category. That doesn't make them unique. They're 60-something% of the counties in the United States are currently in the high transmission category. Virginia Beach is there as well. Virginia Beach has 107 cases per 100,000, which is up from 73 last week. Every place is just really surging. The state of Virginia as a whole is at 90 cases per 100,000, which is just below the high transmission category. Northampton County, which had been hovering right around 0 cases most weeks, now all of a sudden had 7 new cases last week. I'm sorry, 8 new cases this past week. And if you calculate it, we only have like 13,000 people in our county, but you got to, if you count, if you look at the rate per 100,000, that's 68. So the CDC's current guidance, if you have more than 50 cases per 100,000, you're in the substantial transmission category, which means they recommend, if you're in a public area inside, that you should be wearing a mask. It's not a mandate, but we are now in a county that in which indoor wearing of masks in public areas is recommended. That's new. Last week, I mean, we had 0, as it has been the case for most weeks. Only one of those cases is reported from Cape Charles. I'm not certain if that means that none of the other 7 live in Cape Charles or not. I'm not. It may just where they're reported from. I'm not very certain of that. But certainly we're in a county with substantial transmission, so we ought to follow the CDC guidelines. That's my recommendation. So that's the bad news.
Okay, a couple of things, Paul. You don't need to give me any numbers, but what's the death rate look like? Is it worse than it was during the summer? Is it better than what we were seeing with the new variant, or what's that look like?
I know that the reports that I had heard up until a week or two ago, and I'm not sure I have the latest data on that, were that they were less than what had been, at the surge in the winter, because it's younger people that are getting infected, and they tend to survive better than old people did. But I know that the hospitalization rate I've heard on the news in Florida, for example, is now very high, as high as it was in the winter. And they're running into capacity problems in the hospitals now, because of that. So in the states that have low vaccination rates, the hospitals are filling up again.
Okay, and then one other question. We saw in your last report in the email that there was reported negative numbers because the person was established to be from out of state, and that case was transferred to the other case. And we're in the vacation season, so we're seeing a lot of out of state tags on cars. Do you suppose that some of these most recent events, 8 infections in Northampton County, are some of them at least are from
It's possible that some of them are out of state, but remember that's going to be balanced by the fact that that we might have identified cases previously in our county that were out of state, and they've now been corrected. So it may be that the number of new cases actually found in Northampton County was, say, 12, and 4 previous cases were now reassigned or something like that. So the negatives are going to be added into the positives, and that's the 8's the net.
Clear as mud.
Yeah, I know. Well, the bottom line is that we now have a lot of cases in Northampton County, and even more in Virginia Beach and Accomack County. And I went over to Virginia Beach a couple of days, late last week, and I wore a mask every time I was indoors because I knew the transmission rate was high. And now I may well start doing that in the grocery store here again and other indoor areas. That's what the CDC recommends.
Okay. All right. Thanks, Paul.
Now the question is going to come up: does this affect our plans for indoor meetings? And I've looked it up, and the CDC still says it's okay to get together with friends who've been fully vaccinated indoors without masks. So knowing that the risk is not zero, but if you're going to if you have had the vaccination, you can get a breakthrough case of COVID, and you can spread it to others if you're having symptoms. Now, it's not clear that the people without symptoms who've been fully vaccinated can spread it to others. Probably they can, but probably the risk of that is very, very low. So the guidance is best I can make out. And I looked at the CDC site again this morning to see if I could find anything new on this. But as best I can make out, it's still okay to get together with friends who are fully vaccinated indoors, but we've got to limit our indoor meetings to fully vaccinated people. And Chuck, you've brought up whether people that have had documented COVID in the past are in the same category. And actually, as best I can tell from the data, people that have had COVID before are as protected against the Delta variant as people that have been fully vaccinated. Still, the recommendation is that they get a vaccination, at least one.
Yeah. Okay. All right. Thanks, Paul. We'll move on to the next item. Let me bring it up here real quick. Okay. Bill Payne is collecting names for people that would like to go to the Norfolk Tides baseball game on August 29th. I think it's around 4 in the afternoon, right, Bill?
I'm not sure exactly what time it is, but it doesn't matter. It's on the 29th. We'll
Yeah,
figure that out. If I think it's a evening game.
Okay. And that is a Sunday. So if you're interested in going along with Bill and others to the ball game, let Bill know. And if there's enough people that want to go over, that we may hire a bus to take people over.
Chuck, game time is 4:05.
Yeah, that's what I thought. Okay. All right. Projects. Bob, anything on the fire hydrant stuff?
I was on mute.
Bob, you're on mute. Look like he dropped off. Oh, no, there he is. Okay.
Okay, yeah. No, we haven't heard. I've been contacting, but they haven't gave us the okay to go yet.
All right. I don't really have any updates on the caboose, but Mehdi, do you have anything you want to bring up about the basket raffle? You're on mute, Mehdi.
Okay. Well, we are bringing in collections from the merchants of Cape Charles, and I've had 2 donations that are very nice that can go into the basket. And Mary and I will put together the basket the Saturday before it is due, and I think that we have it under control.
Okay. All right. Thank you.
Hey, Mehdi, I've got some stuff that Jackie collected before she left. Do you want me to bring that over?
Yeah, please.
I'll do that.
For August 15.
Yeah, I'll do it right away.
Okay, thank you.
And John Burtis, do you have anything you want to mention about the YMCA?
No, not at this moment. I hope this week has been kind of a blowing out week for me. I'm gonna be out of town this weekend. So next week I'll be back with the group of members who are going to solicit, and I'll have information to hand out to them. So a week away.
Okay. All right.
Thanks.
Okay. Look for members. I know Mary's out there scouting around right now. Unfortunately, we did have one more resignation this past week. Regina has resigned her membership. So we're sorry to see her go. Of course, she has some extenuating circumstances, and of course, we hope that those clear up and maybe sometime in the near future she can rejoin us. certainly the door is open for her. Central Park meeting, I'm getting some fairly good responses. I think we've got total of 16 people, guests and members signed up for the August 17th meeting in Central Park. Remember, please be vaccinated or in some other way immune to COVID. Masks are not required. However, if you're more comfortable wearing a mask, please feel free to do so. Also at that meeting, we'll be taking up any collections for the kids' school supplies. So things, we're going to order backpacks online. Paul will be placing that order. So we're going to have a good supply of backpacks being delivered for the schools, but other things will be needed like notebooks, spiral back notebooks, notebook paper, pencil sets, pen packages, things like that for school. So if you think about it, you're at the store, pick up something, bring that with you at the Central Park meeting. We'll be taking that collection up. And Al Paschal has volunteered to transport that up to the drop-off point for the school kids.
Chuck, can I mention
Go
something?
ahead.
Well, I tried to schedule the site committee meeting of the Invisible History Project at the end of the assembly meeting, but didn't realize that it was the Central Park meeting. So I'd like to reschedule that to the week following, where we are going to have a Zoom meeting again, right?
No, we're not. We're going to have the governor's visit.
Right.
Yeah, we're having that early evening dinner up at the 3 Club meeting the following week.
Then I will have to reschedule it on another day,
Yes.
so we can have a Zoom meeting. But I'm canceling the assembly meeting.
Yeah, keep in mind the week after that, I believe, let's see, that's 24th. No, the week after that will be a Zoom meeting. But then the week after that, the first Tuesday in September, we're looking at our first in-person meeting back at the coffee house. But we're going to play that by ear a little bit from what Paul was saying about the COVID thing. But that's our plans right now.
Okay, so I will let the members know when we can have the meeting.
Yeah, it sounds like 31st would be our last Zoom meeting,
Okay.
hopefully.
Of course, the noon slots on Tuesdays are open for the next 2 weeks. You could always have a meeting then.
Right.
Yeah, that's true. Yeah. Okay, concentrated effort to bring in members, like I say, Central Park meeting. So the August 24th meeting will start at 5 p.m. Bill, does that go until 9? Is that correct? Bill Payne?
It goes until we want it to go.
Okay. So any party animal?
Most people are, moving on when it gets dark.
Okay.
But I don't think we've talked to Monica about when she's going to kick us out.
All right. Okay. And a sign-up sheet will be coming out hopefully by the end of the week for that. We are kind of looking right now at a buffet style dinner with the minimum of 2 selections, desserts, of course, drinks, non-alcoholic. You will be able to get alcoholic drinks if you come at the 5 o'clock hour. It will be cocktail hour, and that will be a cash bar. But at that same time, if you're not interested in alcohol, we will have some other drinks that are part of the dinner. So things like water, coffee, soda, things like that. Estimated about $40 per person. It could possibly be less. For our club, the members will be paid for by the club. If you bring guests, then you'll be responsible for paying for the guests. Again, $40 is probably the very top level price it'll be per guest. We're hoping to get that down somewhat. We're going to keep negotiating that right up to the point where we have to turn in accounts, and that's August 17th. So by the morning of the 17th, I need your RSVPs, and then I'll turn in the accounts. Any questions on that?
I just want to say I'd like to attend both the outdoor meeting at the Central Park and the three club meeting at the yacht club. However, I'm currently being scheduled for a heart pacemaker. So my schedule is a little bit open, so I'm not signing up for anything definite right now.
Okay, when you firm it up, Alan, you can either call me and say, yeah, I'm coming to this one or that one or both.
Right.
And if you're bringing your wife, let me know as a guest to either
Okay.
one of those functions.
Right.
Or
If
you
I
can-
come, my wife will come with me, but I'll let you know one way or the other as soon as I have some definite information.
Okay, either email or give me a call.
Okay. What's that?
Either email me with
Oh,
that or you can
either
give me
way,
a call.
either one way or the other. Right.
Okay, thanks,
Hello.
Alan.
So Alan, don't leave us hanging. Give us more about your health.
What-
Well, my health is good. Is I'm on no medication and all that, so I'm clean from that point of view. But they did, because of some other things that they were looking at, Dr. Cullum ran one of these 14 patches on your chest for 14 days to check your overall heart patterns and so forth. And in that period, he found several incidences, one of which ran for no heartbeat for 5.6 seconds.
Oh,
He says, that doesn't look good. If you go over 6, you probably pass out. So your wife should drive you everywhere until we do something about it. So in any event, this is more of an insurance policy. I have not encountered any restrictions and no, I have not had any fainting spells or anything, but because they've detected some gaps, like several of them over 3 seconds, one as long as 5.6 seconds, no heartbeat. So we want to put a pacemaker on you so that it just stabilizes that, and that's for insurance purposes. So until that is, I have an appointment this Friday with Dr. Goldstein up here at Riverside, and that is going to be scheduled sometime in the next 2 weeks, I would imagine. But until I know, I'm just saying I can't make any commitments to our own particular activity.
Understandable.
Alan, don't
I'm in
fret,
I'm
Alan.
in good shape. I mean, there's nothing other. Heartbeat is strong when it's beating. No clogging, no nothing. That's just, in fact, Dr. Kellum was quite surprised to even see that pattern. He says that's not totally unexpected, but we'll take steps to make sure you're okay.
Well, better to be proactive, that's for sure. Well, we wish you all the best, Alan, and keep us up to date once you get the pacemaker, how everything's going, okay?
Okay, I'll let you know.
All right. And let's see here, hang on just a second. All right. Hey, Bill, real quick question. What was the title of Regina's chairmanship?
She was the international chair.
Okay. All right. With her resignation, we will be looking for a new chairman of that group. So keep that in mind. If you'd like to step up to the plate, would really appreciate it. And the other chairman we're trying to come up with is a person to run the awards committee chairman. That one is actually fairly easy. So it's basically you get an email from one of the members that says, hey, I did 2 hours of community service in the name of Rotary doing this. And you just tabulate it. Okay. And you enter that on a sheet. And, I would suggest keeping tabs on that for each person. And at the end of a month or 2 months, whatever we determine, 6 months, you say, we did this whole total of this many hours of community service. We don't need it broken down by every single person. Just, hey, the club did 632 hours of community service work in the last 6 months. Then we can put in for an award on that. So we're asking for a person that would just be the collecting person for that. And they would be our awards chairman. So keep that in mind as well. Invite friends, family to our meetings. We'd really appreciate it. And we'd really like to have some new faces pop up on our screen. And hopefully we can entice them to come in as a member at the same time. And we are looking at getting back in person the first Tuesday. That would be the day after Labor Day. at the coffee house. Paul is working right now with Roberta to make sure that's going to be okay, and then to work out some pricing and so forth as well. So we'll keep an eye on that as far as COVID goes as well. All right, Bill, what time is it? Happy dollars.
Okay.
We got a lot of people out there. There's got to be somebody that's happy.
Mhm.
Who do we have that's happy today? Alan.
I just got back from 5 days in Michigan with the Burns, Michigan clan. Grandchildren and great grandchildren out there. We had a great time, both in the Detroit, Ann Arbor area, as well as out on the west side in Grand Rapids. So that was this past week. Yes, I missed the meeting and because of flights and one thing and another, but had a great time. So I put in $5 for that one.
All right. Are they native Michiganders or did they?
No, they're all well. No, my son who passed away a number of years ago, first worked in Texas for Texas Instruments and then moved to Michigan for a computer firm up there, but they're all native to Pennsylvania. We all started there and we spread out.
Okay. Okay. By the way, if anybody ever gets a chance to upstate Michigan, the Upper Peninsula is just beautiful.
Okay.
Yeah. Any more happy dollars? Reggie.
Yes, I have 10 happy dollars. One of our grandchildren graduated from college this past weekend, and that was the fourth of 6 so far to graduate, so 2 to go.
Wow.
We also spent a few days in the mountains with the children and grandchildren who are local just this past weekend. So the extra $5 is for that. So it was a tremendous weekend. The graduation, the spending time with the local children and grandchildren, and that was all awesome. So $10 altogether.
Okay. And your grandson that graduated, what was this degree program in?
Well, it was granddaughter.
Okay.
Early childhood education is the area. University of North Florida, UNF.
Okay. So is he looking to getting into teaching then at some point?
She planned, yes. She loves children. She loves taking care of teaching children. So that's her plan at the moment.
All right. Okay. Other happy dollars. Bill Payne.
Yes, I have one happy dollar because I'm celebrating the halfway mark. Jackie's been gone for 30 days. She'll be back in 30 days.
That's only $1?
Yeah, that's the significance of it. Don't tell her.
So what are you happy
Thank
about?
you for pointing that out, John.
So what are you happy about? That she's been gone for 30 days or she'll be back in 30 days?
I'm happy because it's halfway. And that's it.
That's a good safe bet.
No editorials.
You're surviving it, Bill.
Maintaining your weight, Bill?
Yeah, really. I'm doing
It's
okay.
over?
You know, Jackie doesn't cook, so her absence
Oh, yeah.
hasn't been a problem.
Okay. Any more happy dollars?
I have 5 happy dollars.
Okay.
My mother-in-law's surgery went very well yesterday. A few months ago, Andrew's mom, my mother-in-law, diagnosed with cancer. So the surgery went well yesterday, and I'm happy, very happy because of that.
Oh, that's wonderful. I'm sorry to hear about your husband's mother. Hopefully she gets home and gets back up to speed and gets to be at the point just like it never happened. I hope all the best for her.
Thanks.
Okay,
Hey.
Randy, I think I saw your hand up.
Yeah, I have 5 happy dollars. My youngest grandson has managed to make it to Eugene, Oregon. He's enrolled in the University of Oregon in the PhD program for chemistry.
Wow.
Why, I don't know, but he really does love chemistry. I'm going to add one more dollar. I'm happy that Bill didn't really answer Chuck's question about which end, given that this is recorded and she's going to hear the answers.
I was gonna blackmail him. John Burtis.
I've got $10. Today is the second birthday of our youngest grandchild, and she lives here locally, so I get to have cake and ice cream. So
All right,
There you
happy
go.
birthday.
Well,
Maddie?
I have one happy dollar. I mean, this happy dollar is really getting very expensive. But I'm going back to the traditional happy dollar because I've been going fishing to my friend's house at the dock. And yesterday I caught 2 fishes, but then they were small that I had to release them. But I enjoyed the activity very much.
You could have used them as bait.
Well, yeah, we used one as bait.
Okay. All right, any more happy dollars? All right, thank you all. And right now I want to bring on Kara Burton, and we'll get an update on Eastern Shore Library. I know there's been a lot of changes, Kara, over the last year dealing with COVID and so forth, but I wanted to give you a chance to tell us about the changes, all the good things that are happening as well. So Kara, do you need to share a screen? Do you have slides or anything? Okay.
Nope. You gotta look
Welcome.
at me.
Okay.
Great. Well, thank you again so much for the invitation. Y'all really sound like a very busy club and are not letting a little pandemic to deter your activities. So I applaud you in that. And I can echo that here for our staff. We have not missed a beat with the pandemic. We've been following pretty much what all libraries across the country have been doing, which is maybe being closed or maybe just doing curbside pickup or reduced hours or backup and then do it all over again. But it has been a roller coaster ride, but my staff have been great. And I'd like to announce that we just hired a new librarian at the Northampton Free Library in Nassauattucks to help bring that staffing back up to speed, because my full-time person there had left to go work for the school system. And but this is the first time we've had a full-time librarian there. I'd like to invite y'all to a reception that's going to be next Tuesday at 3 o'clock at the library there in Nassauattucks. It's from 3 to about 4:30 or 5, and it's to welcome Hannah Swimley, the new librarian, plus also Tiffany Flores, who is our new youth services librarian, who started in December during the pandemic's height. She had to actually telecommute from another part of Virginia until she was safe for her to move. What has been fun is that both of them are recent graduates of the Syracuse University. And so it's great because we're able to bring new young professionals to the Northampton County. I think this is great, an example of how the library can help with the local economy and quality of life here. We also just today hired another part-time person to help with our staffing and bring it back up. I'd had a number of staff leave over the past year and a half for various reasons. Some of them is actually because their home farm business got so busy they couldn't do both jobs. But I hadn't rehired people. I was waiting till things calmed down and my budget was a little more stable. So we're excited because this other new person is a very young person, a recent 4-year college graduate. So it's been fun working with young folks. So let me give you the things I wanted to update you on were mainly the construction project and then the system services. If y'all have been following the news, you may have heard that we really came to pretty much a screeching halt. It's been about a month or a couple months ago because of a roof situation. The project had slowed down, but had never come to a complete halt during the pandemic until then. But because of the delays, the old roof on the grocery store part of the new library we're building in Parksley had been compromised because it had been additional exposure to the elements. So it was decided structurally we needed to just rip that out and put down a steel roof, which was the best thing. We'd originally had talked about doing that anyway. But we finally got the supplies the other day, and they are now busily starting to work and get the project back up to speed. Once they have this new roof on, then they can start working on the inside construction. And so things will move a lot faster. It may not look that way because as you know from other construction projects, particularly at the community college, you get out when you do things outside on the exterior, you can see dramatic changes. But when you start working inside, from the outside, it doesn't look like they're doing anything, but they will be. So we're very excited. So it may sound like a terrible thing that we've had these delays, and it has been very frustrating. However, on the other hand, it's giving the staff much more time to plan. Because if you all might remember, I just started here 5.5 years ago, so really pretty much had to jump in, and we've had to do a lot of organizational and internal management changes. So to try to do that along with planning a move into a new building has been challenging. So this has given us a little bit more time to work on that. It gave us more time to apply for grants to fund some of this, to take some of the burden off of the local pocketbooks. And then additionally, I've been trying to creatively make use of the federal CARES and ARPA, which is the American Rescue Plan funding to help fund things that we had planned to do in the new building. I can give an example. The CARES money, I'm able to use it for the security system in the new building. So, so this has been good. Again, like I said, it's trying to make use of these federal funds to fund things that we actually do need and things that we had planned on getting anyway. Another example, at the Nassauatics Library, I was able to have time to apply for a USDA rural development grant that put in a new security system there because that had to get updated, and fire alarm system. So that's what I've been spending a lot of my time doing to the point where I'm a good portion, I'd say at least half my time has been spent on development rather than doing traditional library work. So I'm hoping, and I'm very excited to look ahead to maybe 2 years from now, where I'll actually be getting to do more of the programmatic type of things that I love to do. And so that brings me to talking about our strategic plan. The library board has started another 5-year strategic planning process. We're required to do this by the Library of Virginia in order to get our state aid. But it's also, as many of you that are business people know, that it's just good management practice to sit down and plan, review your mission and vision and set your goals for the next 5 years. This certainly helps me with my budget planning. So one of the things that we did when we had a retreat, it was at the end of May, the board had a retreat, was to look at our mission, because I brought to their attention that our mission did not say anything about history in it. Because, and again, it was done in 2016. And I said, this is important because a good large part of our footprint in the new building is for the Heritage Center. And, if we don't have history mentioned in our mission statement, why are we doing this? So they really reviewed that and have made some overhauls. We also have a committee that is really starting to work on the Heritage Center part of this planning process. We did have like a local history component, but now we really have to look at more of a broader scope of the Heritage Center, because this is what I'm looking at is to make sure that we are meeting this grand vision that a lot of folks on the shore have for the Heritage Center to preserve our local archives and do some innovative programs, teach family about managing their own archives, do some digitization projects, and be able to do all that, but without sucking the funding off of the public library end of our business. So, and the example I always give them is when the library system took on the branch at Nassawadox, the library system's budget did not go up. So we took on a building and its staff without getting any more money from the two counties to fund it. So what happens when you do that is you have to start making cuts, like cutting your book budget or cutting, what hours or staffing or whatever. And I want to make sure that that doesn't happen to system services as far as the library goes. So one of the goals, for example, is to make sure that a lot of the Heritage Center's funding is secured by grants, by private donations, and also by endowments. I've done a lot of education with my board over the last few years about endowments. The library does have a foundation with a board of about 16 people, and their role is to do fundraising, but their fundraising has been focused on the capital project, but now it's got to start shifting gears to look at how do we get more bequests? How do we get people to donate to our endowments? An example is when Kirk Mariner, the author, who wrote Off 13 and some other well-known books, when he passed away in his will, he donated his collections, his paper collections to the library for a Heritage Center, but he also donated the house to the foundation with the request that it be sold and the funds from that going into an endowment for an archivist, because he knew that it would be pretty irresponsible for him to expect the library to maintain and preserve his collections unless we had a professional archivist that could do that. So those are the type of things we're looking at. We already have a book endowment. So that's what we're looking at, future planning financially. One of the things that's part of our strategic planning, of course, is talking to the community. And one of the topics I'm starting to talk about with Chincoteague and Cape Charles libraries is, what do we mean by system services? If you didn't already know, the Eastern Shore Public Library has 4 libraries. We're also working on Tangier, helping their library get up and running. But the Chincoteague Library, it's a nonprofit 501c3 organization that has its own board and budget, but we have a contractual agreement with them to provide services and 1 staff person. The Cape Charles Library is a town library, and again, they're funded by the town. Their staff are town employees, but we have a contractual agreement with them. With both those libraries, we have a delivery van. We share books and materials. We purchase their books and catalog them for them. We maintain the online catalog, the online ebooks and e-resources and all that. But when I talk to them, traditionally, it's kind of been understood that the Chincoteague Library kind of serves the uppermost part of Accomack County, and Cape Charles Library pretty much serves, say, like Eastville South. However, Cape Charles Library, they have not gotten extremely busy just trying to manage the visitors and tourists that are coming in there. So, so that's, you know, and it's they have one full-time librarian. I think their youth services librarian. I think she's part-time. I'm not so sure that she's full-time, and they just hired another part-time person. But that's doesn't really leave much capacity to go out to the schools around there, to some of the you know, the community centers. I know, Bill, you work with the Boys and Girls Club. Those are the type of things that people expect of libraries in doing their outreach. We've been, particularly with our youth services librarian, Tiffany, we've been able to do a lot of that type of thing, but it's not so much in the southernmost part of Northampton County. I have a lot of concern about the Capeville area. And then there's also Sheridan is doing a lot of neat things. So that's a question I want to throw out to you all is, what do you think I should be looking at down there? So when I get done talking in a couple minutes, if y'all, maybe we can have a little discussion about that, which would be helpful. So one of the examples of things that we can do, the library, to help our local communities is help with the historic tourism. And I'll give you an example. I recently got a grant from the Northampton Tourism Committee, or their grant, to print 10,000 copies of this Nassawadox History Walking Tour. This is something I developed. I work with Bart Holland, if anybody knows him, with the funeral home. I got in his car one day and we drove around Nassawadox and took pictures, and I took notes. I pulled files from Kirk Mariner's collection. He has extensive clipping files on all the little towns around, and created this walking tour. So if you go to our website, you will see there's the Cape Charles walking tour, Chincoteague, this one, I did one for Parksley. And I think there's one that Watchaprig has, but it's mainly Kirk Mariner's book. Excuse me. So one of the goals in the Eastern Shore of Virginia Tourism Strategic Plan is to develop walking tours for all the towns on the shore. So this is something I've picked up on, the way for us to use our collections, but also teach people, you know, examples of what we can do with local history collections. And it helps tourism, because when people come to the shore, they're very curious about all our quaint little towns, but there needs to be something to do when they go to them. And this is what we call a passive program. I'll have to excuse me, my allergies are bothering me today. It's a passive program where it doesn't involve any staff to have to take anybody on a tour. You know, it's something people can pick up. They're at the visitor center. They're at Northampton Lumber in Nassawadox. There's a bunch of them at the administration building in Eastville and some other places around. So, so this is something that also promotes healthy communities. If any of you all have been involved with healthy communities of the Eastern Shore, they're focused on walking tours and getting people outside to walk. So that's an example of how we can reach out into the community, get involved with the community, give something back, but also teach people about local history and how to use collections and why it's important to preserve our local history collections. So my next on my list of priority ones to do is I want to do one on the other side of Nassawadox that focuses on the hospital and the African-American part of town. And then also on Exmoor, and Exmoor doesn't have one. And I've talked to Robert Dorr, the town manager, about that. So that being said, that's pretty much all I wanted to talk about today. But again, if y'all could let me know what y'all would like to see the library system do down in y'all's neck of the woods, I'll say, on the Lower Peninsula.
Well, Cara, can I had given you an attachment, I think, when I contacted you some time ago about talking to our group about the Rotary project on the invisible history of African Americans. And I really wanted to talk with you about that regarding utilizing the Eastern Shore Library as the archive repository of the oral history and transcriptions that we are going to accumulate as part of that process. Is this something perhaps that we could collaborate on?
Yes, and with the oral histories, that's, we already have some, and that gets into needing different technology to store them, and also make them accessible. So for example, we can just have them on YouTube, but that isn't long-term the best way to manage it. So we have some projects in the works to get some consultants that would help us really develop those. So as you all are developing your project, we're working on our end too, how we, we'll collect oral histories and, and make them part of the collections. So, so when I heard you mentioned about having a meeting a few minutes ago, my ears did perk up and was wanting to know how what the status was of your project.
Yeah, we are ready.
I was going to suggest you and Mehdi talk, because Mehdi's been digging very deep into the local history, especially of African American people within the Cape Charles area, but I think she extends out a little bit from there too into other parts of Northampton County. I too am very much interested in history, especially local histories. And interestingly enough, you brought up something that I had written down before you even brought it up. I have some genealogical ties to Tangier Island, and I've been over there several times, and I've spoken with people and spent a lot of time in the museum over there, as well as the entire island, there's cemeteries, and talking with people. I'm glad to hear that you're looking at some representation over in Tangier Island. I've been working the last year on developing genealogical information for all the people of Tangier Island. And I was wondering what kind of archives you may have about Tangier Island, specifically maybe at the Nassauatics Library, since that is Accomack County. Do you have any kind of extensive collections for Tangier Island history and people?
Well, the Kirk Mariner collection would probably have things because he did write a book on Tangier. But if you're doing genealogy, the first thing to go to is the Miles files. Have you looked at them?
No.
Okay, the Miles files is on our website. If you look under genealogy, and that was created by a couple of brothers.
Okay.
And it has over 40,000 records of Eastern Shore families.
I will definitely look that up. Some family names in my family, I'm not directly descended from them, but they're cousins and so forth. But the popular names over there are obviously Crockett, Evans, and Pruitt, and I have some of those family names in my family, and they're in the Maryland, Virginia area of the Chesapeake Bay, either on the Eastern Shore side or on the Western Shore side. So I'm sure those people were descended from some of the earlier people that were on Tangier Island, and I'm trying to make those connections. But at the same time, I want to pass over to the museum over there a good, solid genealogy, historical content that I'm working on to get over to them. So,
well, I know that there's somebody over there that has done a lot of that. I don't remember their name, But if you call the museum is open now. They can probably put you in touch with that person. One
Okay.
thing I am going to give you a tip on searching the Miles files. Don't just hit print, because when you find somebody, I can give an example. I found Robert Burton, who's one of my older ancestors, and I thought when I hit print, it would print off his article, which would look like it was maybe 1 or 2 pages, but it started printing off like 40 pages. Because the way that database is, everything all runs together.
Okay.
So it's not like a normal website. I'm just giving you that tip because I don't want you to freak out like I did when you hit print.
I'll keep that in mind.
But yeah, contact the museum over there. They are open. The volunteers are probably there like from 10 to 3. The
Yeah.
library on Tangier is part of the museum. And so I've have been working with both of them.
Okay.
For example, we do a books by mail project with them. So if they want books, they just request them and we mail them to them and give them postage to mail them back.
Okay. Yeah, I was over there for a few days just about 3 weeks ago, and I spent pretty much 4 or 5 hours in the museum one of those days and
Yep.
talking to the people there. So it's a very
Good.
interesting culture there, very interesting and wonderful people.
Yep.
Cara, Bill Payne. The Cape Charles Library seems, it doesn't have staff. You have tremendous staff relatively, and it doesn't make sense that we have 2 entities. What consideration is given to the Eastern Shore Public Library and Cape Charles Public Library integrating or becoming one?
They tried that at one time. And it didn't go well. Probably because of the management at the time for our library. I don't know the details of it. I just know there were some sour feelings. And, it was well before my time. I don't know if Ann Rutledge was manager at Cape Charles at that time either. Miles Barnes would be the one that would know about it, but I can say that they have their own board and their own friends, and I doubt that they would want to take that route.
But wouldn't it make sense in terms of productivity and access to resources to
Consolidate.
resources?
I don't know. I can't answer that, Bill. I mean,
Okay.
this isn't an uncommon model. When I was a library director in New York State, a lot of their library councils or systems had a combination of what they call free libraries or nonprofit libraries. They actually had school district libraries and municipal libraries. And so that was one reason I think they hired me, because when they talked about this model of different types of libraries, it didn't faze me because that was normal. But in the rest of Virginia, most of them are either just a county library, a regional library like ours that are made up of county libraries, or city libraries. Ours is kind of unusual in that we have the 3 different, structural type of libraries. But
Well,
I mean, it's fine that way. It's just I don't think that they have the capacity
Of course they don't.
to reach out beyond the town, because the town has changed. I mean, that's it's not the oldest library, but it's the oldest one still in operation. It wasn't the first library on the shore, but it's the oldest one still in operation. And, think of how much Cape Charles has changed since then. And you have all these, the challenge is you have all these people coming from cities and other areas where their libraries are so much better funded than ours are here. I mean, it's a night and day difference. I mean, people are used to being able to download video, stream videos, movies, and have much more ebooks and have more staff. They have a lot more programs. And so they come here and they walk in the libraries and are expecting that. And, we just can't deliver, particularly not at Cape Charles. So my heart really goes out to them because that's a lot of pressure that people put on the staff there when they walk in. And so that's a question that the board hopefully would discuss down there.
Thank you.
It seems the status of many institutions in the area that they have really not moved into the trends that are occurring nationwide or at least region-wide. And many are kind of operating as a mom and pop operation still.
Cara, I have a couple of questions. Was it a question, Mehdi, or was it a statement?
Well, I just kind of stating an idea about Bill Payne's observations about the library.
Hey, Maddie, can I give you a call this afternoon and to talk about how we are gonna put the basket together?
Sure.
I need to call you. Okay,
Sure.
thanks.
Cara, you mentioned the outreach to places like Capeville and other areas outside of Cape Charles. Is that a personnel issue within the library system, or do you use residents who would like to assist in those types of activities?
Well, that's a good two-part question. Yeah, so the first one about using volunteers, yes, we would want to have volunteers help staff, which we do elsewhere. A lot of times when we do outreach at events, say like at the Ag Fair they were having at Machapongo, we would often ask for volunteers to help us. But I think that we really need a committed outreach staff to reach out to these areas. What was I getting ready to say was an example of something. Oh, I can give an example of something we have done. At the regional jail, they Reverend Calvin Jones has the program where they work with some of the inmates to do
Yes.
training with them. Okay. So one of the things we did, he reached out to us and they did a project at Christmas time where some of the inmates were given a children's picture book that's what the library fit in. We got them the books and they inmate would read the book and the reading was recorded as a video. And then the book and the DVD was given to their child as a Christmas gift, which I thought was a wonderful, touching project to work on. And that one didn't really require much of any staff on our end. It was just a matter of us getting the books, picking out a book and sending it to them. So that's one example. A lot of people bemoan not having the bookmobile anymore, where, and a lot of times now in other communities, they have bookmobiles, but they also, when they're doing them, they go out and do like a story time or do an activity when they're set up at a location. So, there's a lot of things like that, because it's really hard for people to sometimes have the transportation to get to a library. However, on the other hand, bookmobiles are very expensive to operate. And it's also the way people's lifestyles are nowadays. To tell somebody, oh, on Wednesday from 1 to 3 o'clock, the bookmobile will be on the corner of such and such street in Capeville. You know, and how many people are going to show up? You know, you don't want to spend, because I've budgeted, it would cost well over $200,000 a year to have the bookmobile up and running again. And, you know, and if we only get like, we show up there and you have maybe 5 people show up, is that really cost effective? There are a lot of neat things nowadays. For example, you know, the red box machines where you can get DVDs in the cities, they make them for books now and they can hold 200 or 500 books. So that's the type of thing too. You could set these up somewhere. Some communities have done them at firehouses. There's also a much less expensive thing where it's a locker that we would put the holds that books that people have actually requested. And it's like the things they have in the post offices and people who go pick them up. So there's a lot of neat new things that technology is providing. And, you know, and there are programs that we could go to churches or community centers to do. But again, for us to make that extra step up to go further south than that would require us to get more staff, as well as Cape Charles. So that would be the question. Should Cape Charles get more staff or should we get more staff? And that would be a question for the, you know, citizens of Cape Charles.
Okay, thank you.
Does that help give you an idea?
Yes, it does.
Okay, well, Kara, we really appreciate you joining our meeting today and giving us these updates. And of course, we're all hoping the whole COVID thing will at some point be history too, that we can read about maybe next year it's history. And I think that's going to make your job a little bit easier, although I know you're busy. And I have to tell you, when I go by the Nassauatics library, it's really nice now to see cars in the parking lot and people going in and out the door. So that's a great thing to see. One last question, are masks required to go inside the libraries yet, or we haven't got to that point?
Not at the moment.
Okay.
What we've been doing is following CDC guidelines. I'm still waiting from the local health department guy. I emailed him last week and I think they're still trying to figure out things. Things are just kind of moving fast. And we get such conflicting comments from, you know, from the CDC too. You know, it changes every day. I just remind the staff is to just make sure that you are washing your hands, washing the surfaces,
And
you know,
get back
and the social distancing. I think that's the big key. People are getting lax about social distancing.
Yeah. All right. Well, again, we really appreciate you coming here, and you know, we'll check back with you for some updates as things move along with this whole COVID thing. And we would really welcome you to be a member. So I know you're busy during the day, but if you find some slot of time in there to visit us in person and become a member, we would love to have you.
Thank you. I used to be a member of Rotary when I was in Syracuse and when I was Danville, and I will give this feedback. It's very expensive to join Rotary. I love its mission, but on a librarian's salary, it's just not feasible. So, but I love their mission because it's always been a focus is on literacy. In fact, one of the questions I had for y'all, the other clubs I was in, they did a lot of with the international clubs where they would do the exchange program. And they would also host the, I think, was it a group study exchange where they'd bring in like a whole group from, say, Brazil, and you would tour them around different businesses and all. I don't know I haven't heard of any of the clubs here doing anything like that.
Not over here. I'm sure in the big city clubs and the college towns and so forth, that's probably the case. But we have not gotten to that extent. We do contribute some funding to international programs and so forth like that. But I'll be honest with you, with our club, we do a lot of local community work. So that's always interesting. Anything from painting a caboose to doing what you're doing, like history type stuff. So of course, you seem to me to have a deep interest in history as well. So I can kind of see where you would blend in real well with the club, especially working with Betty. So again, thank you very much. And we will stay in touch with you and get further updates as we move along and get through this whole COVID thing. Thanks again, Kara.
Great. And if anybody wants to give me more feedback or ideas about the services that in Lower Northampton County, please don't hesitate to email me. My email is cburton@espl.org. Thank you.
Thank you. Okay, Bill. All right, for the benefit of the membership, the things we think, do, and say. Number 1.
Is it the truth?
Truth.
Number 2.
Is it fair to all concerned?
Concerned.
3.
Will it build
Will build
goodwill and better
goodwill and a
friendship?
better friendships.
And 4.
Will it be beneficial
Beneficial
to
to
all
all concerned.
And Stan's not here today, so Bill, you're going to stand in for Stan.
Okay, will we have fun?
That we will. Okay, you did it almost as good as Stan, Bill.
Oh, hey, Chuck, will you and Paul stay on?
Yeah. Thank you, everyone else, and have a great day and the rest of the week. Take care now.
Bye-bye.
Yeah, I wanted to ask you guys, are you on for this meeting with Blake on Thursday?
I can do it.
Yeah, I can do it, but you know what, where I'd like to be is we have made these 2 dinner selections and dessert selections, period. Tell us, give us your best price and maybe ask them, hey, do you need a day or so to get your best price? But we really need to start the let's get a count of people going, because we're 2 weeks away from having to turn in the numbers.
Okay, those are 2 different issues, but I just want to make sure I can get back to them and tell them we're on for Thursday at 10 o'clock.
Yeah, I'm fine with that, but I don't want him to think I need to get them how much each dinner would cost depending on what they select and all these other, we really need to have a selection. Now, Paul brought up the point that we need to get buy-in from the other 4 or 2 presidents. The problem I see with that is if we select 2 items we like, they select 2 items they like, now we've got.
No, you compromise on the 2 items.
No, we select the items. I didn't mean to imply that we should get their input on the items we select.
Yeah.
I just thought we ought to tell them what, give them some details about the meeting and tell them there'll be 2 items and you can start spreading the word to the membership and we'll give you specifics in a couple of days.
Yeah. I sent you a message, Paul. I kind of estimated out that if we had X number of members and they brought X number of guests, I forget what the number was, but on the email, it was basically about $565 would be the cost for the members, not for the guests. Is that outrageous or is that in line with your thinking?
I just think we ought to get the best price we can because the members are going to have to pay for their guests as well.
Yeah.
I mean, right now we're doing fine in our operating budget, but I think we need to keep our expenses as low as we can.
Yeah. And we'll have the capability working right up to August 17th when I have to turn in the numbers to keep working on the price. But the main thing is to tell them what we want to price on. So we need to get him.
Yeah, but if he says, we go in with maybe 3 possibilities and say, we could go with the top round or the pork and, if one of them's $3 less a plate than the other one, or not a plate, but per serving, then that might be enough to make a difference.
All right. Well, I don't want him to have to go through the entire menu and give
Oh,
us
no,
a
no, no,
price on
no.
everything. So I'd rather have,
I thought
like you
we
said-
had talked about getting, wanting him to price the salmon and and maybe the top round and maybe
Yeah.
get a price on the pork too.
all right,
So that would only be 3.
all right,
uh,
that's fine.